Thank you for viewing our applicant briefing for COVID-19. My name is Sharon Joseph, and I am the FDEM Recovery Bureau Appeals Officer. A copy of this presentation, all referenced materials, and other resources will be made available to you. Governor DeSantis declared a state of emergency on March 9, 2020, and the President issued a nationwide emergency declaration on March 13, 2020. The FEMA disaster number for this incident is DR 4486. To be eligible for public assistance, work must have occurred within the area listed on the screen. For this disaster, the entire state of Florida is eligible. The incident period is defined as the time span during which the disaster-causing incident occurs. The declaration designates the incident period. You, as the applicant, are responsible for showing that the work was required in response to or to address damage caused by the declared incident. For COVID-19, the incident period began on January 20th, 2020. The RPA deadline is nationally extended and will remain open for the duration of the public health emergency. FEMA will accept RPAs for 30 days after the end of the declaration of the public health emergency and provide 30-day advance notification if an earlier deadline is established or further extended by a regional administrator. The Public Assistance or PA program is a federal supplemental financial assistance program to local governments, state agencies, and certain private nonprofits, which will reimburse applicants for eligible response and recovery activities required as a result of a disaster declared by the President. A federal cost share program is no less than 75% federal and 25% non-federal. For this disaster, the cost share is 75% federal and 25% non-federal. For non-private nonprofits, the non-federal cost share is further broken down to 12.5% state and 12.5% local. This is a nationwide major declaration. The available programs are the Public Assistance Emergency Work Category B, and under the Individual Assistance Program, the Crisis Counseling Program. Emergency protective measures are activities taken before, during, and after a disaster that are necessary to eliminate or reduce an imminent threat to life, public health, or safety, or they eliminate or reduce immediate threat of significant damage to improved public or private property. Some examples of eligible emergency protective measures for DR 4486 are activation and staffing of local and state EOCs, emergency medical care, medical sheltering, additional security hired for logistical staging areas, and search and rescue operations. Information you may be required to submit include management, control, and reduction of immediate threats to public health and safety, Emergency Operations Center costs, training specific to the declared event, disinfection of eligible public facilities, technical assistance to state, tribal, territorial, or local governments on emergency management and control of immediate threats to public health and safety, non-deferrable medical treatment of infected persons in a shelter or temporary medical facility, related medical facility services and supplies, temporary medical facilities and/or enhanced medical hospital capacity for treatment when existing facilities are unreasonably forecasted to become overloaded in the near term and cannot accommodate the patient load, or to quarantine potentially infected persons, use of specialized medical equipment, medical waste disposal, medical sheltering when existing facilities are reasonably forecasted to become overloaded in the near future and cannot accommodate needs, and medical transport. All sheltering must be conducted in accordance with standards and/or guidance approved by the HHS or CDC and must be implemented in a manner that incorporates social distancing measures. Non-congregate medical sheltering is subject to prior approval by FEMA and is limited to that which is reasonable and necessary to address the public health needs of the event, is pursuant to the direction of appropriate public health officials, and does not extend beyond the duration of the public health emergency. Documentation required to claim costs for eligible emergency work labor include the name of the employee, job title and function, type of employee, whether FTE, temp, exempt, or non-exempt, days and hours worked, including time in and time out, pay rates with fringe benefits, description of work performed provided in daily logs, activity reports, or other methods, timesheets, and your pay policy. The information on the screen comes directly from the FEMA Public Assistance Program and Policy Guide, otherwise known as the PAPA G, version 3.1, Table 10. The applicant may assign an employee to perform work that is not part of the employee's normal job. Overtime costs for the backfill employee are eligible as long as the employee that he or she is replacing is performing eligible emergency work. Employees reassigned for duties that are outside their normal duties does not mean that their regular hours are eligible. Backfill employee hours are eligible if they were unbudgeted as per the table provided in the previous slide. For specific guidance, please refer to the PAPA G Applicant Force Account Labor Section A, which is found on page 23. Response activities and associated costs conducted at EOCs are eligible provided they are associated with eligible work, including but not limited to increased utility costs, costs to lease a facility, supply costs, and meal costs as described in the PAPA G. Subrecipients often provide meals for emergency workers. The provision of meals, including beverages and meal supplies, for employees and volunteers engaged in eligible emergency work, including those at EOCs, is eligible provided the individuals are not receiving per diem and one of the following circumstances apply. Meals are required based on a labor policy or written agreement that meets the requirements of the PAPA G. Conditions require employees to work abnormal extended work hours, or food or water is not reasonably available for employees to purchase. FEMA only reimburses the cost of meals that are brought to the work location and purchased in a cost-effective and reasonable manner, such as bulk meals. FEMA does not reimburse costs related to group outings at restaurants or individual meals. Costs related to the subrecipient purchasing supplies or using its own stock to perform emergency work are eligible for reimbursement in accordance with the PAPA G. Examples include, but are not limited to, safety equipment, personal protective equipment, and radios. Purchasing and packaging life-saving and life-sustaining commodities and providing them to the impacted community are eligible. Examples of such commodities include, but are not limited to, food, water, ice, personal hygiene items, cots, blankets, generators, as well as food and water for household pets and service animals. The cost of delivering these same commodities to the unsheltered residents in communities where conditions constitute a level of severity such that these items are not easily accessible for purchase is also eligible. This includes food and water for household pets whose owners are in shelters. The cost of leasing distribution and storage space for the commodities is also eligible. Eligible medical care may include, but is not limited to, triage and medically necessary tests and diagnosis, treatment, stabilization, and monitoring, first aid assessment and provision of first aid, vaccination for survivors and emergency workers, durable medical equipment, consumable medical supplies, temporary facilities for treatment of survivors, such as tents or portable buildings, leased or purchased equipment for use in temporary medical care facilities, security for temporary medical care facilities, use of ambulances for distributing immunizations and setting up mobile medical units. When the emergency medical delivery system within a declared area is destroyed, severely compromised, or overwhelmed, FEMA may fund extraordinary costs associated with operating emergency rooms and with providing temporary facilities for emergency medical care of survivors. Costs associated with emergency medical care should be customary for the emergency medical services provided. Long-term medical treatment is typically ineligible. FEMA determines the reasonableness of these costs based on Medicare's cost-to-charge ratio, which is used to estimate a medical service provider's actual costs in relation to its charges. FEMA does not provide PA funding for these costs if underwritten by private insurance, Medicare, Medicaid, or a pre-existing private payment agreement. The subrecipient must take reasonable steps to provide documentation on a patient-by-patient basis, verifying that insurance coverage or any other source funding, including private insurance, Medicaid, or Medicare, has been pursued and does not exist for the costs associated with emergency medical care and emergency medical evaluations. Examples of ineligible costs include duplication of benefits, benefits from the CDC, HHS, Florida Department of Health, USDA, or FDACS, continued school meal service during school closings, loss of revenue and tax revenue, medical care costs incurred once a survivor is admitted to a medical facility on an inpatient basis, and administrative costs associated with the treatment of survivors. An applicant may use the value of donated resources to offset the non-federal share of its eligible projects. The donated resources from a third party. The applicant uses the resources in the performance of eligible work, and the applicant or volunteer organization tracks the resources and work performed, including description, specific locations, and hours. FEMA considers unpaid individuals who volunteer their labor to an applicant to be third party even if they are officially members or employees of the applicant organization. An example would be volunteer firefighters at a private nonprofit volunteer fire department. FEMA prepares the donated resource project separately from the emergency work projects for the applicant's incurred costs. FEMA does not obligate the donated resource project until after it obligates all of that applicant's emergency work projects. At a minimum, work must meet each of the following 3 general criteria to be eligible. Be required as a result of the declared incident, be located within the designated area with the exception of sheltering and evacuation activities, and be the legal responsibility of an eligible applicant. Not all costs incurred as a result of the incident are eligible. To be eligible, costs must be directly tied to eligible work, properly documented, not a duplication of benefits, not prohibited under federal, state, tribal, or local government laws or regulations, consistent with the applicant's policies and procedures, and necessary and reasonable to accomplish the work. To begin the RPA process, you'll need to click the Apply Now button on floridapa.org. Follow the steps outlined in the RPA Guidance PDF. While applicants still need to submit RPAs in Florida PA, FEMA is simplifying the public assistance application process. This event is for Category B reimbursement, and the simplified application process enables FEMA to eliminate many application steps that are designated, including exploratory calls, recovery scoping meetings, most site inspections, and reducing documentation requirements. The FloridaPA.org site manages the PA grant in Florida. The site manages the PA process from application through closeout. This table displays a list of the PA project development documentation requirements. FEMA provides PA funding for contract costs based on the terms of the contract if the applicant meets federal procurement and contracting requirements. FEMA's procurement guidance for recipients and subrecipients under 2 CFR Part 200 provides additional details regarding federal procurement and contracting requirements. Local governments and private nonprofits must use their own documented procurement procedures that reflect applicable state and local government laws and regulations, provided that the procurements conform to applicable federal law and standards. Applicants must perform a cost or price analysis in connection with every procurement action in excess of the simplified acquisition threshold, currently set at $250,000, including contract modifications. The method and degree of analysis depends on the facts surrounding the particular procurement situation. Make independent estimates before receiving bids or proposals, and negotiate profit as a separate element of the price for each contract in which there is no price competition and in all cases where a cost analysis is performed. FEMA reimburses costs incurred using 3 types of contract payment obligations: fixed price, cost reimbursement, and to a limited extent, time and materials. The applicant must include required provisions in all contracts awarded and maintain oversight to ensure contractors perform according to the conditions and specifications of the contract in any purchase orders. The FEMA Contract Provisions template outlines these required contract provisions and can be found on FloridaPA.org under the PA Info tab. FEMA does not reimburse costs incurred under a cost plus a percentage of cost contract or a contract with a percentage of construction cost method. FEMA advises against the use of time and materials contracts and generally limits the use of these contracts to a reasonable time based on the circumstances during which the applicant could not define a clear scope of work. FEMA may reimburse costs incurred under a time and materials contract only if all of the following apply: no other contract was suitable, the contract has a ceiling price that the contractor exceeds at its own risk, and the applicant provides a high degree of oversight to obtain reasonable assurance that the contractor is using efficient methods and effective cost controls. The applicant should define the scope of work as soon as possible to enable procurement of a more acceptable type of contract. An emergency is a threat to life, public health or safety, or improved property that requires immediate action to alleviate the threat. An exigency is a need to avoid, prevent, or alleviate serious harm or injury, financial or otherwise, to the applicant, and use of competitive procurement proposals would prevent the urgent action required. The use is only permissible during the actual exigent or emergency circumstances. The duration will vary for each incident. It does not always coincide with a governor's executive order. Any work done must specifically relate to the exigent or emergency circumstance, and it's important to remember that the state has different requirements than local governments or private nonprofits. The governor's executive order does not waive federal procurement requirements. A waiver of state or local procurement requirements does not mean a waiver of federal procurement requirements. The following procurement standards apply even in an exigency or emergency, including the required contract clauses located in Appendix 2 to Part 200 of the CFR, awarding to a responsible contractor, completing a cost or price analysis, not using cost plus percentage of cost contracts, and following the time and materials contract requirements explained earlier in this presentation. Once the exigency or emergency has passed, you must seek to competitively procure any remaining work. These requirements must be met regardless of any waivers of state or local procurement policies. The scope of the contract matches the scope of the work to be done. The contract must have been procured in compliance with all applicable local, state, and federal procurement rules. The contract must contain the required federal terms. The applicant's policy must allow piggybacking. The contract itself must have a clause allowing piggybacking. Must properly document the procurement and the contract. Must justify the use of a piggybacked contract over competitive procurement. Both exigency and emergency circumstances require the same level of documentation. The circumstance for exigency or emergency situations falls under 2 CFR 200.320 F2. You must identify the circumstance requiring a non-competitive procurement, describe the product or service and expected price, explain why a non-competitive procurement is necessary, state how long the contract will be used for, the defined scope of work, describe the specific steps taken to determine that competitive procurement could not have been used or was not used for the scope of work, describe any known conflicts of interest and any efforts made to identify possible conflicts of interests before the non-competitive procurement occurred. If no efforts were made to identify possible conflicts of interest, explain why. Include any other information justifying the use of non-competitive procurement in the specific instance. In order to receive reimbursement, the applicant is required to enter into a funding agreement. The funding agreement is a contract that establishes the relationship for the grant program between the recipient, FDEM, and the subrecipient, the applicant. The funding agreement outlines the terms and conditions of accepting federal funding through the Public Assistance Program. Applicants will enter into a funding agreement during the project development phase. As you may recall, beginning with Hurricane Dorian and future storms, amendments for each additional project will not be required. As required by 2 CFR 200.331, the Compliance Unit monitors subrecipients of public assistance funds using a risk-based approach to ensure they comply with all financial, administrative, and programmatic requirements. As a part of the subgrant agreement package, each subrecipient will receive a risk assessment questionnaire that will assist the Recovery Bureau in determining the type and level of monitoring needed throughout the program. Federal regulations specifically require FDEM to monitor and assist subrecipients in the PA process. FDEM will work with subrecipients to achieve continued compliance with all program requirements. The compliance team oversees federal single audit report reviews, risk assessments, and monitoring activities. There will be training, outreach, and education opportunities from the Recovery Bureau. All documents are subject to an audit by the state, FEMA, and the U.S. Department of Homeland Security Office of Inspector General. You must maintain all records for 5 years post-grant closeout. The applicant is responsible for establishing and maintaining accurate records of events or expenditures related to recovery work for which you request FEMA assistance. Applicants must also provide quarterly reports to FDEM via Florida PA. Failure to properly document any claimed expenses may result in a loss of funding. As a reminder, the important steps are getting Florida PA access on the floridapa.org website, submitting your RPA, and as always, documenting your efforts. Please visit our new website listed on the slide to ask any COVID-19 questions you may have. Several answers to commonly asked questions are already available to you on this website. We will answer your questions as quickly as we can. This concludes this presentation. Thank you for watching.